Hi there, my name's Lucy Haslam. I'm the co-founder and director of United in Compassion, and it's my pleasure to welcome you to this exciting course. I'd like to give you a brief background to help you understand the motivations for providing Australian healthcare professionals with this unique and valuable resource. My hope is that you will gain a deeper understanding of what many of your patients are confronted with when Western medicines and treatments do not offer the relief that patients had hoped for. And my goal for you will be that you feel inspired to not only become a more educated practitioner, but to gain a renewed level of inspiration, like that which you felt when you first joined your profession. My cannabis journey has reinforced to me the need for reliable, evidence-based and independent education for healthcare professionals who may feel some resistance to considering cannabis as a medicine for their patients. My background was as a registered nurse, and my husband Lou, he was a 35-year police veteran, with much of that time spent in the New South Wales Drug Squad. We were fairly strict parents of 3 sons, and back in 2010 we were effectively anti-cannabis in our views, like most parents at the time. But long-held views were challenged and very dramatically changed following the diagnosis of stage 4 bowel cancer in our youngest son Dan. He was just 20 at the time. By 2014 things were grim, and Dan was in the fight of his young life. He was having fortnightly chemo, and he'd been on this gruelling regime for 4 long years. Chemo had only been interrupted by radiation and many complex surgeries on his liver and bowel. The cancer was extensive. It was invading his bowel, his liver, his lungs, and eventually his bones. And Dan was suffering from anticipatory nausea, where just the thought of chemo would make him vomit. Dan was hospitalised every fortnight on a drip for the duration of his 3-day treatment. It was the only way he could remain hydrated. He had tried every available antiemetic. He was losing weight, he was deeply depressed and anxious. He had cavernous mouth ulcers, and he was in the grip of an opioid and benzodiazepine dependency, with absolutely non-existent quality of life. Our family was watching on in helpless distress, with no expectation that the situation could improve. But Dan's life and our lives changed unexpectedly in 2014 when he was offered cannabis by a fellow cancer patient. And although we had strong anti-recreational cannabis views, we desperately encouraged him to try it. My husband drew on his skills as an undercover drug officer, and he rolled Dan his first joint, and we nervously watched on as our non-smoking son awkwardly inhaled. And if the situation had not been so serious, it would have been funny. To our astonishment and in joyous disbelief, the medicinal cannabis almost immediately relieved many of Dan's symptoms. The colour came back in his face, and he asked for something to eat. He no longer vomited during chemo, which meant he no longer had to be hospitalised. He had an appetite, and as he experimented with the use of cannabis oil, he cleared up his mouth ulcers, he reduced his pain and anxiety. He slept better, his life was better, and so was ours. Dan talked about having some control back, and for a terminally ill younger person, that was hugely important. The only problem was Dan was now a criminal, and so was I. Our only option was to turn to the illicit market to buy cannabis for my dying son, who stayed up late into the nights, nervously turning cannabis flower into oil. It was like a sick scene from Breaking Bad. Dan tried to remain hopeful, but I was in constant fear, and I just felt so terribly sad that our son had to resort to this to get some relief. I felt compelled to speak out, and once we did, the floodgates opened, and many other patients began to reach out to me. At the same time, I was impressed by the compassionate suppliers who were essentially filling the role of doctors and who gave a level of kindness and knowledge that was clearly needed. They became like heroes to me, offering instruction when it was not available elsewhere. I began to research the history of cannabis prohibition, both globally and in Australia. I delved into the politics, including the several Senate inquiries in Australia over the decades and as recently as 2013 in New South Wales, and I read every submission with interest. The latest inquiry, like so many before, had unanimously recommended that cannabis be reintroduced for medical purposes. Importantly, I researched the science which was rapidly emerging from countries like Israel. I met and spoke with Emeritus Professor Laurie Mather. He was responsible for devising patient-controlled analgesia, and also Dr. Alex Wodak of the Alcohol and Drug Service in St Vincent's Hospital in Sydney. Both reassured me that Dan was not in any harm's way using cannabis to manage his symptoms. I was relieved and grateful for Dan to have some respite. I realised that my long-held views were based on misinformation, and that it was misinformation that had informed and shaped our laws and attitudes both here in Australia and internationally. One of my light bulb moments when I was given a book, Marijuana, the Forbidden Medicine, by Harvard Professor of Psychiatry Lester Grinspoon. Professor Grinspoon told me his own story about his terminally ill son, also named Daniel, and I heard my story back. Just as we were seeing our sons battle with the side effects of cancer and chemotherapy, Professor Grinspoon's son had lived that same torment back in the 1960s. Even more amazing was the fact that his wife had procured cannabis for his son illicitly and that the results had mirrored our experience. I reached out to him and we shared our experiences together. Based on his son's experience, Professor Grinspoon went on to become one of the greatest opponents of the war on drugs and cannabis prohibition, and one of the greatest advocates of medicinal cannabis that the US has ever seen. I could see that I could no longer be silent about the situation, and an incredible wave hit me. The only way I could respond was to share what I was learning to try and combat the ignorance and the bias that was so ingrained in our culture. Despite the unanimous recommendations of the New South Wales Senate inquiry in 2013, the New South Wales Health Minister remained vehemently opposed. This was even though her boss, New South Wales Premier Mike Baird, was supportive of Dan receiving such effective therapy. Dan's story was screened on Channel 7's Sunday night program. In an online poll afterwards, they received a record 2.82 million votes, with 97% in favour of legalising medical cannabis. This was a turning point that finally made the politicians take notice. I knew that the educational vacuum was alive and well in Australia and that medicinal cannabis was nowhere to be seen on the medical curricula, not being supported by the medical profession publicly. Yet experts from other parts of the world clearly supported medicinal cannabis for patients like Dan. It was a void that I set about in my own way to fill from 2014, when I held the first Australian Medicinal Cannabis Symposium at a time when it was still illegal. But this event got the ball rolling and resulted in New South Wales Premier Mike Baird announcing that New South Wales would legalise cannabis for the terminally ill. That was a small win, but not enough for many patients with various conditions that I had met by that time. Then a federal cross-party bill to legalise medicinal cannabis was also announced at the symposium by Dr. Richard Di Natale. Professor Lester Grinspoon gave the opening address, and the audience was introduced to the work of Professor Raphael Mechoulam from Israel. And most importantly of all, Dan gave the closing address. And he could see that hope was on the horizon. The event also resulted in the generous philanthropic donation by the Lambert family to set up the Lambert Initiative at Sydney University. This had the main purpose of supporting research into the medical uses of cannabis for paediatric intractable epilepsies like Dravet syndrome, which was a condition that was destroying the life of the Lambert's little granddaughter, Caitlin. But my cannabis education and lobbying was in full swing, and it took me to every level of government. I felt compelled to challenge the law and to fight for a previously legal and respected medicine that has the scope like no other substance I am aware of, and which has a safety profile that in itself should provide tremendous reassurance. Yet I've been astounded with the levels of resistance from those in positions of authority and at every educational level. So many times we were challenged as just supporting recreational cannabis use, and this could not have been further from the truth. It's a controversy that still continues today and which this course hopes to address. We intend to leave you with no doubt that giving cannabis consideration for your patients is absolutely the right thing to do, and that exploring the option carries little risk for you as a professional healthcare practitioner. Recently, David Nutt, an esteemed Cambridge-trained psychiatrist and professor of neuropsychopharmacology at Imperial College London, published an essay in the British Medical Journal in which he said, doctors have a moral imperative to prescribe and support medicinal cannabis, further supporting the views of a growing body of doctors. Medicinal cannabis has many eminent supporters within the medical and scientific professions. Since 2014, I've met many scientists and global experts. In 2016, I travelled to Israel as part of the Premier's delegation, and I met the grandfather of cannabis research, Professor Raphael Mechoulam, and renowned scientist, Dedi Meiri, who studies the use of cannabis in treating various cancers. I've met PTSD champion Dr. Sue Sisley, medicinal cannabis all-rounder Professor Ethan Russo, and paediatric epilepsy specialist Dr. Bonnie Goldstein from the US, to just name a few. I've been astounded and inspired by their enthusiastic support for medicinal cannabis education in Australia. I've met hundreds of patients during my advocacy. Those patients have included this course's first benefactor, Olivia Newton-John, who, as a high-profile cancer and cannabis patient, has gained enormous benefit from cannabis and who, like me, wants the same for other patients we've met along the way. I've also observed the making of documentaries like A Life of Its Own, The Truth About Medical Marijuana by Helen Kapelos, and High as Mike by DC Stories. Countless patients have described incredible outcomes which have reinforced that the need for a shift in attitudes is not only long overdue, but essential. The health profession needs to demonstrate that it is serious about doing the best to meet individual patient needs rather than being dismissive and belittling when patients attempt to have that first difficult conversation. The insertion of personal bias into the discussion comes at great cost to genuine patients. The law changed in Australia in 2016 on the first anniversary of Dan's death, and a new industry was born. The laws and regulations also became more complex and burdensome than anyone had been promised, and the conversation quickly changed from demonstrating compassion to the need to control and regulate. In truth, Australia was presented with a regulatory system which was complex in nature, time-consuming to navigate, and completely at odds with the busy profession of the healthcare practitioners needed to prescribe it. Medicinal cannabis is approved, yet it remains technically unapproved. It's available only through limited pathways, so it is effectively in a regulatory limbo. The medicine is and remains very expensive and well outside the reach of many Australian patients. It will be difficult for cannabis products to become registered on the ARTG because research has been banned for so long, and it will be almost impossible for them to be listed on the PBS anytime soon. This has given greater inspiration and opportunity to the illicit market, who are still to this day servicing tens if not hundreds of thousands of patients because of both cost and the sad reality that patients are still being shown the door by their regular GP or healthcare professional. This sad reality demonstrates to me the system is not fit for purpose and more needs to be done. In 2020, to address the many remaining needs of the sector, I joined forces with Dr. Teresa Nicoletti, a scientist and lawyer, to form the Australian Medicinal Cannabis Association, or AMCA for short. Teresa and I had worked together to assist many patients who in the early days of legalisation in Australia were being denied access to prescribed medicinal cannabis, largely at the behest of state and territory bureaucracies. Other like-minded people, including Dr. David Caldecott, scientists, pharmacists, nurses and industry members, also willingly joined us to attempt to have regulators reduce the many barriers and better support legitimate access. Our first major project at AMCA was to establish the Society of Cannabis Clinicians Australian chapter in November of 2020, and to try and encourage education and support healthcare practitioners. Our first project at AMCA was to establish the Society of Cannabis Clinicians Australian chapter in November of 2020, to try and encourage education and support of healthcare professionals. Effectively, it is a group of healthcare volunteers hoping to steer the path of access, which is devoid of vested financial interest and intent on raising the profile of medicinal cannabis for the benefit of Australian patients. In 2014, I was fortunate to meet Dr. David Caldecott, who spoke out in support of my and Dan's efforts to change the law, when many other health professionals were more comfortable speculating that Dan was only interested in getting high. Just as I'd been misinformed, most Australian health professionals are well informed on the many body systems, but completely in the dark about the endocannabinoid system and the valuable and extensive role of endogenous cannabinoids in the human body and the potential of phytocannabinoids from cannabis. This vital topic has been omitted from the health curricula for too long. Dr. Caldecott set about to address this by writing the Australian Medicinal Cannabis course after studying a variety of international sources. He bequeathed this course to the Society of Cannabis Clinicians Australian chapter, and it has been further developed by the SCCAC advisory panel of clinicians and scientists experienced in the endocannabinoid system and the prescribing of medicinal cannabis. The SCCAC advisory panel has made a commitment to regularly review and expand this new training program to ensure it is always up to date and independent, and to help you support your patients. The project will be funded by the charity United in Compassion that Dan and I began, through unrestricted educational grants from the medicinal cannabis industry. Rest assured that although funded indirectly via industry, this course is and always will be independent of industry influence in order to retain RACGP accreditation and to ensure your trust. Our aim is to build the best possible medicinal cannabis education resource in Australia. So here we are at the very start of our course, the endocannabinoid system and what you didn't learn in med school, which has a clear goal of increasing the knowledge and expertise of healthcare professionals through education to gravitate patients away from the illicit medicinal cannabis market to a place where they can regain some dignity and empathy, avoid criminalisation, and get the safe, effective healthcare that they desperately need. This is Dan's legacy and my way of fulfilling a promise I made to him before he died. It is a task to uncover the truth about medicinal cannabis and to extend compassion to all those who need to lighten their burden of suffering. It's been my personal experience that healthcare professionals who do learn about prescribing medicinal cannabis for their patients become the greatest advocates of all. And that is my wish for you.